Hello, it's me, Blackbird again. Just me and my little fur baby. He likes TikTok too. It's been 7 hours since I left my doctor's appointment at the VA. I'm still just blown away by today's events. I'm still trying to wrap my head around what actually happened. Um, I've been dealing with this theory of polyvagal. It was first suggested to me. Right now, I'm still not even able. But I've been dealing with this within the VA system for more than a year and a half now. Trying to get a doctor that can treat, who even knows what polyvagal is, to see if I even had it, to see if it was something that was, that worked with what I have. I've not known anybody else that had polyvagal. My doctor has. My psychologist has. And he's treated people for it before, and they've recovered. But within the VA system, there was nobody that had even heard of it. And it boggles my mind. I've been dealing with this psychologist on the psychological aspects of this. But if in fact, I did ask him about this today, we discussed that it is very possible that I've been dealing with this since I was 4.5 years old. I've always had a huge thing for unfairness, which ties into, and I'll talk about that later, ties into this event when I was 4.5, and there's a lot of things that it's all coming together. But I've been dealing with this so long, and some of the patients that he's dealt with have only had it for a couple of months, a couple of years. I didn't get to ask him that question, but I've been dealing with this so long. The effect on my body is something that makes it unique in and of itself for how long I've been dealing with it. So even though he's given me the tools to be able to unlock psychologically, and God bless him for doing that and having the patience to stick with this, the man's had an amazing career, but the physical part of it has never been dealt with. Yes, I acknowledge, the psychologist tells me, yes, I acknowledge that you have this. There is no doubt. This is how you fix it. And the techniques are just basic exercises that orienting my body and my brain, and just different exercises for that. But the extent of the damage, the problems with my jaw that doesn't recapture, the problems that I'm having now with my esophagus, that one side tries to go up while the other side's trying to swallow down or something. There's some kind of test that they did. My spine being pinched at my lower back. The foraminal narrowing in my spine, and my cervical spine. These are just the things that they have observed. There's no, once it's a soft tissue concern, oh, that's soft tissue, that's physical therapy. We'll send you to somebody for physical therapy, unless it's something that can be operated on. So I'm not one of those people because they can't even identify what is happening. What's causing my body to grind? Other than, well, doctors have said, oh, it's bone spurs. Well, I didn't have any at the time. They did all their tests. And sports medicine doctor from England was like, oh, nobody else can do this test as well as my people. We find the problem when nobody else can, and there were no bone spurs. It's the muscles, it's the knots, which massage therapy should help with, but it's been so long, and the damage has been so extensive. And I really needed to talk to my doctor about some of the things that are happening with chest pains and muscles that are moving and bowel issues and, just all these different flipping things. And after 15, 20 minutes, my doctor says, I feel unsafe. The number one thing that doctors ask me whenever I talk to them about my depression getting to the point where I just don't want to go on with it. And they always ask me, well, why didn't you? And my answer was always, well, my mother. I love my mother, and it would have broken her heart. I'm her only son. I'm all that she had left in the world, pretty much. So that kept me going. She passed away 2 years ago, in December, Christmas Eve. I know there are other people that would be heartbroken if I didn't go on, but this has really pushed me. But here's the trick. It didn't push me to give up. This has pushed me to fight harder. I'll be back. I'm not done talking on this. But right now I need to calm myself because my jaw has been getting so much tighter over the last 7 hours. And I'm doing myself more harm than good. And I'm